Every year, thousands of Americans just like you suffer from hepatorenal syndrome.
When my doctor told me I had hepatorenal syndrome, I thought my life was over.
Liver transplant, hospitalization, and worst of all, a strict diet? I can't imagine life without my bourbon-soaked bacon-covered banana brownies.
I went to doctor after doctor, and they all said the same thing. We just can't cure it. I started to wonder if any of them actually went to medical school.
But then I found out about spontaneous recovery.
Spontaneous recovery.
Spontaneous recovery.
It's a revolutionary new treatment for hepatorenal syndrome from the doctors of Washington University.
Leading nephrologist Dr. Stephen Chang calls it the most effective treatment for hepatorenal syndrome. And studies show it's significantly better than placebo.
Spontaneous recovery uses the body's own natural mechanisms to jumpstart recovery.
Spontaneous recovery got me back on my feet with no lifestyle changes necessary.
And since no liver transplant is necessary, there's no unsightly scar. And no prolonged hospital stay to keep you out of the gym.
Spontaneous recovery is not for everyone. If you don't have a healthy heart or an earth-shatteringly improbable amount of luck, you may not benefit from spontaneous recovery. While using spontaneous recovery, you should not take certain medications for high blood pressure or pinch yourself to see if you're dreaming. If you experience any fever, cough, nausea, vomiting, dizziness, vague sense that you forgot to turn the stove off, excessive emotional responses to sports losses, or difficulty finding your keys in the morning while using spontaneous recovery, call your doctor on her private cell phone immediately and leave several voicemails. Side effects of spontaneous recovery may include diarrhea, anxiety, erectile dysfunction, hallucinations of large red lobsters, pulsus paradoxus, brisk reflexes, bullous pemphigoid, hypoactive reflexes, intoxication, and social awkwardness. In some rare but serious cases, patients have experienced acute death, latent death, intermittent death, and even chronic death.
So talk to your doctor today about spontaneous recovery.
It worked for me. It can work for you.
Get back on your feet the natural way, with spontaneous recovery.